My dad passed away, and he was an atheist. And when he died, I watched him. He came back, and he stood there next to me with the biggest smile on his face and said, I was wrong. I am now in divine peace and I'm filled with joy. I saw Dad's family. There were 7 members. I saw all of them with him. They came to pick him up and help him come back. And then I was reading from A Course in Miracles, Lessons 109, I rest in God. And that's when Dad appeared as his aura, and he just said, I was wrong. And he went home with a big smile, and I knew he was at peace. I was filled with love and joy. I didn't cry because that's where I want to go. It's just so blissful and so peaceful. There's nothing to fear.
My guest today is Dr. Rod Chelberg, who has experiences, the first one as a result of strep throat. And after this first near-death experience, he had incredible abilities that he didn't have before. The ability to deeply meditate, the ability to see people's auras, and the ability to astral travel into places like the dimension behind me. But Dr. Rod shut those abilities down and later had a second near-death experience and has now become a medical intuitive, completely connected to the divine to help heal people. So Dr. Rod, welcome. So thank you so much for being here today.
Well, thank you for having me. It's really quite an honor. And I love to spread this message to people that they too can have these experiences without having a near-death experience, but they can still learn to tap into the divine and experience wonderful things.
That is an incredible message. And this is really the reason why I love to talk to people like you, because you've brought back so much wisdom from these experiences. And then people have a chance to hear your story and understand how things work so that they can implement them into their own lives.
Exactly. That's exactly right.
So you're the very first person that I'm interviewing with this new background. I'm in the process of switching studios. So I apologize to everybody that I do not have my microphone with me. But it's ironic because Dr. Rod was telling me before the interview that he's actually traveled to this place, to this earth place, this mural that I have behind me. So I think it's fair that he gets to be the very first person to have an interview with the new studio. And that's just
I'm
how
on.
things work.
Yeah,
So why don't we start with you talking about what happened leading up to this first near-death experience when you were very young and had strep throat?
sure. So I was in 2nd grade and I had strep throat, and no big deal usually, but strep can be a nasty infection and it can infect your heart or your kidneys. In my case, it affected my kidneys, and I was treated with high doses of penicillin. That was the only real antibiotic we had. I was in the hospital for 2 weeks. During that time, one evening, about 8 p.m., I had got a shot of penicillin and I was getting ready for bed. But then I realized something is seriously wrong. I found that I was itching and I was finding it very difficult to breathe. And finally, panic set in as I said, I can't breathe. So your lungs fill up with fluid in an allergic reaction. So you're suffocating and drowning. So during that process, fear kicked in, but then I separated from my body and I became this white outline of my body. And I articulated and I floated to about 90 degrees upward. And then I was drawn out of this body. And I said, I'm dying. And at first I was afraid, but as I went down this tunnel, I saw this light at the end of the tunnel, a little pinpoint of white light. And as I got closer to that light, all fear left me. I felt very comfortable, very warm, a sense that I'm going home. And it's a delicious feeling. As I got close to that light, the opening got bigger and bigger and bigger, and I can see inside, kind of like an Easter egg where you can see the pictures inside, they hollow out the egg. But it was pure white light, scintillating white with gold flecks. and this warmth just engulfed me. And excuse me, I just felt tremendous comfort, almost to the point of entering that light. They had revived me with medication. They realized, the nursing staff realized I was in trouble and having an allergic reaction. So they gave me the antidotes, and I immediately got slammed back into my body with tremendous force. And I didn't know what to make of that. I said, that's one heck of a dream, basically. Didn't think anything about it. I had no more fear. I could breathe. I just went to sleep. And I never knew what a near-death experience was until I met another doctor who studies near-death experiences. I said, I had this crazy dream. He said, Rod, you had a near-death experience. That was about 3 years ago. I said, really? That's interesting. So that was my introduction. I didn't think much about it, but in second grade, in 1969, the Moody Blues put out a song called Floating. Floating among the stars. Don't ask me to sing. But I thought, I wonder if I can do that. So I turned the light off in my bedroom and I laid down, and it turns out I did. I dissociated from my body, floated up, and then I rotated and I saw me laying in the bed. And at first I went around my bedroom, felt pretty safe. But then I thought, I wonder if I can go beyond this. And I grew up on a crop farm. So I went outside and I could see everything clearly. I was about 10 feet off the ground. And there's no pain, there's no hot, there's no cold, there's just tremendous peace. And I saw Dad working on the tractor, and I saw the buildings. And I went around that several times. And I did that for a while. And then I thought, I wonder if I can go farther. And so I did. And my last trip, I went to Paris. And I was floating across the people. I could see them eating. I could see the checkered tablecloths. And I know it's Paris because I saw the Eiffel Tower in the distance. And I thought, that is really cool. Completely comfortable, completely safe. So that was my first astral experience. I shut that down
Rod,
because
how old were you when this happened? I'm sorry to interrupt you, but I didn't catch the age that you were. Was it very much after that near-death
yeah,
experience?
so whatever second grade was, that was about 69, 68, 67, about 2 years, something like that.
So like 8 years old, probably.
Yeah, a young kid.
Okay.
But at the same time, I also I learned to sit in a chair, a very comfortable chair, and immediately I could uh, put all that monkey chatter noise behind, and I could connect with a divine essence. This tremendous feeling of love and warmth, a presence was right there with me. And I did that for about a year. Then the third is, on occasion, I would see colors on people's hearts. So I'd look at you and say, oh, your heart's green, or oh, you're blue, you're red. I didn't know what they meant. Later in life, I started reading A Course in Miracles, which is an independent self-study course to get you in tune with your divine self. And I learned that blue is divine love, blue is divine creativity, red is divine love, and green is divine health. So I can look at somebody, not everybody, but on occasion, I see the colors. And as I entered medical school, I could see these colors more frequently. But as a young kid, I talked to my friends, do you see colors on people? And they go, no. Do you float out of your body? No. So of course you want to fit in and be not called a wacko. So I shut all of those senses down and let it go. But I was always attracted to spirituality, and I started in 74. I started reading Silent Unity's literature on New Age thought about spirituality and life beyond death and how to heal yourself, and I was just sucked into this. Read that a lot of the material, but again, I didn't do much with it. In medical school, at the end of my residency, I trained as a hospitalist doctor, ICU, critical care medicine. people have been banged up for whatever reason, and they're on ventilators and drips. And I started to see this colors in people, and I could tell when they were going to die. And I could tell when they were going to live just by looking at, I could see their auras on them. And if their aura started to turn black, I knew they were going to die. If their aura started to turn white, I knew they were going to live. But that's the Reader's Digest version of my near-death experience. That's my
Okay.
first.
Okay, that's amazing. Thank you for sharing that. I have a question that immediately popped into my mind as you
Yeah.
were talking about the people in these hospital settings who you knew were going to either live or die based on their aura colors. So
Mhm.
I'm curious if somebody's aura was appearing gray, dark, black, you knew that they were going to die. Would you then still continue to try to do something to save them, or would you switch gears to a different method of maybe just comforting them? Like, how would you approach that? Because that's got to be almost a conflict of, you're there as the doctor to save, to save, to save, but on a spiritual level, something else is happening.
Right. Well, I don't make that decision. I explain to the family, in my experience, when you have three body systems that are affected, heart, liver, kidney, okay, the body can handle three, but if you have a fourth system, like now I've got an infection, you're not going to survive. The body's overwhelmed. So I always would educate the patient if they could understand me, but I educated the family and say, we've got four systems down. I've never had anybody survive that. I will keep going, but you tell me what you want. And they say they're never going to be the same. I can tell you that. So brain injury is common. If there's no improvement after a week, it's going to be limited. So I did not make the decision, but I'd always also ask the divine. I would invite the Christ presence, the divine presence in, guide me and help me and bring peace to the family. And I always would hold my patient's hand, and sometimes I'd hold it to my chest and ask for guidance. Sometimes people knew they were awake enough. They said, I don't want to go on like this. I'm so sick. I'm so full of cancer. And I said, okay, then I'm going to start turning the life support off and, you know, make them very comfortable with a little medicine, not knock them out, but make them so they could still talk. Take all the tubes off, turn off all the alarms, all the machines, and then invite the family back in. And there's their parent, their loved one, just resting comfortably in bed. And usually within half an hour, they pass. And it's a lovely experience because everybody's at peace. They know we did the best we could. It was time, but the presence of Christ is in the room. And that is tremendous peace that they feel. And there's joy. So there's a sad crying, and I've done that scenario. I've done that, I don't know how many hundreds of times. So, but it's a
Would you
smooth
ever
transition.
That's good to know, and I think that that's probably brings a lot of comfort to the people who will watch these videos, knowing that that is surrounding the room as somebody's getting ready to pass away that they love. So would you often or at all see the spirit, the soul leaving these people's bodies or have an experience with them in spirit?
Many times. Um, Let me back up just a second. Nobody dies alone.
I love that.
So you get a trauma patient in and they're so banged up, no matter what I do, they die. But I get to see the other side of relatives, angels, loved ones, waiting for them to leave, to catch them and bring them home. You can't see that. I can't see that. Well, I can, but it's nobody dies alone. They got family on this earth side, but there's also the divine. There's been angels. family members who have passed coming to pick them up. So I want to put that out, that you're never alone. There's always help. So that was that. The first time I saw a lady, we got a code call, 80-year-old lady who was in cardiac arrest coming into the ER. And I did the code on her. She was in asystole, which means no heart rate, no heart rhythm, for 20 minutes. And now I've been studying the course. I've been meditating. I've had a lot of mystical experiences. And I always been in the habit of praying. And I use the Catholic prayer, and I'd pray with their hand on my chest like this. And I would say, Our Father who art in heaven, hallowed be the name. That was my Catholic prayer. And I prayed for every patient. My last act as a physician is I know somebody asked on their behalf to be taken home. So then I decided one time, I wonder what will happen if I ask Christ to come. Will Christ come? I've never been taught that. So lady's dying. I'm holding her hand to my chest. And I said, Christ, will you come and take this lady home for me? And I'm asking. So on my left side, a red aura bead appeared in the ER. We had called the code. She's dead. Called the code. People all left. And I'm just still holding her hand. And this red aura appears on my left side. Then I look at my patient, and her aura separates. It's white. And she has a perfect outline of her face. She smiles to me and says, thank you. And then she melds with that red aura. It's white and red, and they meld as one. And then they float across my visual field and go up to the right. And these beautiful golden gates open, and two misty white arms come out and embrace both of them and pull them in. And then the door is shut. And I'm trying to peek in. I'm like, what was that? And I had profound peace and joy and love. The entire ER turned into a scintillating white light. And I knew that was divine. And what I heard is, you just helped birth somebody into heaven. I have seen this now 4 times as clearly as I'm seeing you. I have had very similar occasions where I felt the presence. So for me, it's God, Christ allowed me to see this. I don't have the power to say, come say, that's not me. I was allowed to see the beauty of birth. So I've delivered babies. It's a mess. It's not my favorite thing, but birthing somebody into heaven is glorious. And to see that somebody is peaceful and get to see the divine take them home is beyond words.
I bet it sounds like it would be.
Hmm.
So when you're doing this, you've also mentioned that you've been guided as you've been trying to help people with an injury and illness, etc. So will you share a little bit about how that part works for you?
How much time do you have?
I don't know, probably all day, because this is so fascinating. I could probably
Well,
talk to you for about 3 hours.
yeah, I have so many stories, but I'll pick out a few. I wrote a book about this, When God Calls, Say Yes. So the first time, a lot of times it's a strong feeling, a strong intuition. But in these cases, I could hear the voice of Christ talking. It's always in my right ear. So about a 40-year-old woman came in. She was well-dressed, working in her office, collapsed and was unresponsive. Called the paramedics. They bring her in. She's clearly dying. She's got all the signs of she's gonna die. And I was at the head of the bed, and Christ said to me, push on her foot. So I did. And as I did that, it went tap, tap, tap on my hand. That's an abnormal reflex, which means brain poisoning. And I said, okay. And then the next thought was, see, she has clonus. That's the tap, tap, tap. She has Tylenol poisoning. Give her the antidote. And so that's not a routine ER lab. That's second tier, third tier. So I ordered a Tylenol level plus the other stuff, but I also ordered what's called an ammonia level. Tylenol breaks down into a poison, kills the liver, and that becomes ammonia. And the ammonia gives you this brain death. You've got 3 days to save someone's life. But I ordered the Tylenol level immediately. It came back critically high. So we gave her the antidote and saved her life. And the nurses said, how do you do that? Why would you even think that? And I go, I don't know. And so that's one story. Saved her life, and she went home. She was very grateful. It turned out she was taking Darvocet, which is a painkiller and has 500 milligrams of Tylenol in it. She still had a lot of pain, so she was taking over-the-counter Tylenol. 4 grams of Tylenol, that's your limit. You take more than that, your liver shuts down. So that's where the Tylenol poisoning came from. The second story I'll share with
That's
you.
incredible. That's incredible.
Yeah, it is. It is. And the second story is a 15-year-old boy was running in the playground, tripped and fell, and was kind of unresponsive for a little bit. Got up, kept running, scunned up his knees and whatnot. And so at 6 o'clock that night, mom was a bit worried to bring it. So she brought her son in, and everybody's rolling their eyes. A kid tripped and he's scun up. So we fixed his little bruises. And the minute I put my stethoscope on this boy's chest, Price said to me, this child has metabolic syndrome and he had a heart attack. Do a stat cardiac enzyme. All right, 15-year-old kids don't get heart attacks. So I ordered it. And everybody's like, Chelberg's lost it. It's the end of his shift. He's checking out. And I got razzed. But that changed real quickly when it came back. The level should be less than 0.1. This was 3.57, indicating a massive heart attack. And that got everybody quiet. We immediately started cardiac rescue medications, ended up transferring him to Boston, to Children's Hospital. And his left main artery was 95% closed. And so they put a stent in. So that boy would have died if we didn't get cardiac care. Ended up saving his life. That's called the widowmaker lesion. And because once that last little bit goes, you're dead. So that's another experience. And I have learned to listen to that voice. And people say, you're a really smart doctor. How do you figure this out? And my answer in my mind, I never say this, but I'm very good at listening. I'm not that smart, but I'm very good at listening. And when you hear the voice that clearly, and you are filled with a knowing, a oneness, an utter conviction, I don't care what the world says, I'm going to do this. So that's another story. I could fill it up with lots of stories, but you get the idea that you as you go down this road, your spiritual senses, the more you trust that intuition, it starts with intuition. Start with that and let it grow. I trust you, Father. I'm going to listen. And I don't care if the world thinks I'm wrong. So simple things I do now are, Father, where did I leave my keys? They're upstairs in your pant pocket from yesterday. Thank you, Father. And I go up and get them. It gets to be that easy. It's practice. It's trusting. And it's learning that the world is not what you think. And you always have guidance. And the Father is always talking to you. You have to learn to pause your monkey chatter brain and listen. So I'll give you one more story. I'm in the ER. And I was the medical director. As an ER doctor, you're not supposed to leave the ER because the ambulances are always coming in with sick people. But they have 2 cardiac code teams in the hospital. And the cardiac code went off, Dr. Blue, OR Suite 4. And I went, great, I don't have to go because it's in the OR. And there's 2 code teams. So this lady was in the OR post-op, and she coded, and the cardiac teams were working on her, and they gave up. They said, we were shocking her, we're giving her rescue medicines, nothing's working. So the charge nurse runs into the ER, grabs me by my shirt collars and pulls me up and said, "You've got to come right now. I'm not supposed to leave." And I said, "I'm not supposed to do that." She said, "You're coming." She was big. I moved. So I'm running down the hallway with this lady, and I walk into the room. On my left is the patient. She's clearly dying. She's got bluish skin. They're ventilating her. The OR crew is on my right. The anesthesiologist is crying uncontrollably. The code teams have left. And I stopped. And my question was to the divine, I just stopped and paused. What are we missing? And the divine told me she has metabolic acidosis, which is like vinegar in your blood. It's lethal. And that's what we're missing. So I ordered the antidote, which is called bicarbonate, and it's baking soda, and it neutralizes acids. It turns it back to water. And as I looked at the heart monitor, she had a very malignant heart rhythm, and that's what they were treating appropriately. But that wasn't the real rhythm. It was hiding underneath it because of the acidosis. So once I treated the acidosis with the bicarb, the underlying rhythm became what she was really dealing with, which is what they missed, which was just a fast heart rate. And then I gave her the antidote for that heart rate. And I asked the nurse, I said, it suddenly slowed down back into a normal sinus rhythm. And I asked the nurse, is that a perfusing rhythm? But it didn't matter. The woman immediately woke up, pulled the tube out, and started moving. And a complete miss on the other team's part. But I listened to, you've got to stop your thinking. Listen, give God a chance to speak. He'll tell you what to do. So a lot of times it's intuition, it's a feeling. Sometimes it's very clear voice. Sometimes you see. It all depends what is best needed to communicate with you. But most importantly, you look at whatever the situation. I've lost money, the house burned down, a marriage, good or bad. Always you want to get in the habit of saying, Father, reveal yourself, talk to me, and then stop thinking. You've got to create the pause.
That's amazing advice. I think that that's practical on so many levels. When you saw that patient and you walked in the room and you said, this patient is dying, her skin is blue, did you happen to notice what color her aura was?
I didn't really recall seeing it. It happens really quick. In other cases, I was at I took a friend to a theater, and we were watching this, and I said, I was being cocky. I said, "You see that guy over there?" "Yeah." I said, "He's got a black aura. He's going to die in the next 6 months." And my friend grabbed my arm and said, "That's my uncle." And I went, "Oops." He had
And did it
metastatic.
happen?
Yes, he had metastatic prostate cancer and died 6 months later. He didn't tell anybody.
And what did that friend think? Because I'm sure that they remember that whole encounter with you.
Yes. They're just like, and after that, I decided I'm not telling people what they're, when I see that black aura, I'm not going to say anything. It's too upsetting, but I've seen it many times. And what I
Does it
try to
also
do is,
have the ability to become a self-fulfilling prophecy? Is there a way to reverse that? Because we've all heard of cases where somebody had cancer, they had a miraculous healing. There was some illness that everybody thought, they've got a 7%, a 10% chance of living, and they're going to be brain dead, and they come back and they're fine. So it's probably never really over until it's over, is it?
well, it depends. Is the person receptive to healing? So I
Okay, well,
had
that's
three,
a great direction to go then.
yes. So I've had 3 cancers: colon cancer, kidney cancer, and testicular. And they're all lethal. And then I had this massive stroke that took out my right side, my left face, lost my memory. It was bad. In all of these cases, I chose not to believe in the reality of this illness, but rather see it as darkness. It was not created by me, or it was not created by God. It's an outcome of all the stress I was under from the ER, all of these. And my body broke down. And God's saying, you've got to stop, slow down. So this is what we're going to do. But you have to say, this is a dream. This is an illusion. This is not of God. And I see it as darkness. And I invite God in. And I don't get fearful. I invite God in. And I don't say, Father, heal me. I say, Father, let me feel your love and your peace. So I had the surgeries. And then the doctors want to do the chemo and the radiation. I said, no, I don't need this. I'm good. So all 3 cases, lethal cancers, treated with simple surgery, and I'm out of here. And the stroke, that's where I had my second near-death experience. Like I said, my left face, my right arm, completely paralyzed. And I refused to accept that. And I was treated. And I had what's called a shared death experience. So the entire ER turned into scintillating white light. And I saw everybody's life, God, energy. We're all divine beings. And we put this bodysuit on. We think the bodysuit's real. It's the veneer. And I saw the oneness, and we were all connected with this. And I should have died. It was that big. And I said, Father, if I'm here to serve, let me serve. Something like that. And after 10 minutes, all the light went away. And I did not see that red aura of Christ. So I knew I wasn't going to die. And then I became very intentional and very determined. I said, I'm walking out of here tomorrow. Now, the nurses are giving me a hard time. That's not possible. I refuse to accept the negative energy of these people. I refuse. And I get no, I am going to walk. That morning, I got up and I walked out of that hospital. So I still had deficits, but I set my intention that I am going to be healed through the power of God that I have within me, that's in my heart. And I'm going to release that beautiful light, and I'm going to be healed. And I can give you several more stories, but those are the big ones.
Well, that one's really powerful. I want to stay there for a second. I'm curious, during any of those cancers, did you have a chance to see your own aura? Are you allowed to see your own aura?
I did not. I did not. I was so focused on my intention. I have seen my own aura on occasion, but to me, that's mind candy. It's fun, it's interesting, but I want to talk about God. You know, I don't want to talk about chakras and acupuncture and Akashic records. That's quantum physics. Yes, we can talk about that. I do okay, but I want to go home. What's the quickest way to get from here to LA is a jet. I get on the jet. You know, some people want to walk and look at all the fun stuff along the way. That's fine, you know, but I just want to go home. So to see my aura doesn't help me. I want to see God. And that is that scintillating white light that lights everybody up. And that's called Christ vision to me, that I get to see that. And I try to see that in everybody I meet. And I look at you and I say, oh, I see you as a woman, but I also see inside of you your divinity. I see your white, beautiful light that is pure, it's clean, it's innocence. It's just gorgeous. That's what I see.
And we all have that, is what you're saying, right?
What's that?
We all
It's all,
have that. Is that what you're saying?
yes, yes. And it doesn't matter because you're seeing, you're looking at Hitler and Gandhi, evil, good. But you have to learn to see through that the way God sees and said, they are my divine creations, an extension of me. They get a choice to put whatever bodysuit they want on. But you look past that, you see that their divinity, and you say, but they're also part of me. And so you see that is Hitler is calls for love. I don't agree with it. Gandhi has his own path where he's sharing love, the duality of humanity, if you will, good and evil. But you want to look past that. You want to look past the appearance of somebody dying, past the appearance of a broken relationship, and say, I am a divine being of God, and God created me. That's what I want to focus on. The body's going to fall down and make all kinds of mistakes. I do the best I can, but I screw up. But I don't beat myself up anymore. I don't pass judgment. There's no grievances. I just said, I fell down. It's okay. I apologize. And I put my hand up and say, Father, lift me up. I want to be centered in Christ consciousness all day long. I choose peace instead of this. It's one of my favorite sayings. And another one is, I and my Father are one. And God is living through me, and I want to be a living expression of God to the world. So that's what I try to do to the best of my ability.
Beautiful. So you did say that you had a second near-death experience during the stroke. Would you care to share that one with us?
That's pretty much what I was saying is the I was given medicine. The whole when I have given this medicine, it's quite dangerous. People usually die within 10 minutes. If it's going to go bad. So you got to be, that's a lot of, this is called the internal medicine cross. Please help me. So I'm watching this, knowing that my chance of death is very high. The ER doctor made a mistake. I had an internal bleed that he didn't check for. That was a mistake. So I'm thinking, you just gave me a major clot buster medicine that causes things like that to open up and bleed. I had an ulcer in my intestines. But he gave it to me. So I'm thinking, I'm going to bleed to death very quickly here. Okay, that's the preamble. So at 2 minutes, the whole ER, as I said, turned into a scintillating white light. The people in the ER, I could see their divinity, their divine nature in their body, but they all had white auras, but inside there was this gold. And there was gold flecks all through the air. The machines were all gold, white light. And I just relaxed. And I said, brought the divine in. And this beautiful peace filled me. I was comforted. And like I said, I did not see the red aura of Christ. So I said, I'm probably not going to die because he's not here to pick me up. And I just waited. And it's such profound peace at that time of transition. There's no worries. It's just like, I'm good. The 10-minute came and then everything went back to normal human vision. All the light went away, but the peace remained. But then it was, you are going to walk out of here tomorrow, which is not possible. But I did. And the nurses were astounded and they wouldn't let me go. They said, well, we got to do this. I said, no, I'm good. So I kept ringing the call bell, bugging them. They said, all right, get out of here. But that was the second, it's called a shared death experience because you get
Okay, you were explaining that before, and I think I was confused because shared death experiences, at least the people that I've interviewed, would be like your father is laying in the bed, he starts to leave his body, you also start to leave your body, you have an experience with them where you don't get to go very far, and then you come back. So will you delineate for us the difference between a shared death and a near-death experience from what your perspective is?
Yeah, I guess, remember I'm a newbie at this. And that was I talked to Lee Whitting, who does a lot of near-death experiences, and he said, it sounds like, because you can see the people. I did not see my dad, or any, I just saw the people in the room, but all the machines, God is everything. And we put it into, with our mind, we change things and put it into form. I saw the divinity of everything. And there were people in the room. That's why I say it was shared, because I got to see their
So
auras.
that they actually experienced what you were experiencing?
They experienced a tremendous peace. They, you
Okay.
know, my nurse's technical assistant was there, and she said, "We knew you were going to die," and my friends who are doctors that I worked with were in the room, and they're all just, and all of us, you could just see the, oh my God, this is like bad. They all relaxed, and then all their defenses went down. And I can't explain this piece well enough. That's why I call it shared. We all relaxed and accepted, and there was peace. I
Okay,
have
thank you.
seen,
That's a good way to explain it. I understand now why you would
I
call it
think
that.
I would say there's variations on that, you
Mhm.
know, that perhaps my parents would have been there, but I think this was enough to, you know, like if you were in the room, I would have seen you as white light, and I could feel you, and I would know what you were thinking. We're all
And I,
connected.
in the room, would have also connected with you and felt
Yeah.
that peace and that love, and that's that shared.
Yes. Yes.
Okay. Okay, that makes a
Yeah.
lot of sense.
Yeah.
So, Rod, when you have these experiences and you're noticing that you are being guided to help heal people, there's a term that I often hear when somebody has had a near death experience and they come into an ability like this that they didn't have before, and they will call themselves a medical intuitive healer. Does that
Mm.
resonate with you? Do you feel like that's what you've become now over time?
Um, I've heard that term many times, and I guess one man, I do a little counseling service, spiritual counseling service, and I was talking to a man in England, and I said, "You have to go to the ER now." I said, "Your aortic valve is going to close soon, which is the main valve of your heart." And he was complaining about back pain and neck pain. He was in an auto accident. Forget that, you know. So I could see his valve scarred down, and he took my advice, went to the ER, and I said, "You're going to get a heart valve, and then you're going to be out of the ER in 5 days. You're going to be out of hospital in 5 days." And so he goes to the ER, and they listened to his heart. They ordered a stat echo. They took him to surgery that morning and got a new heart valve. And he said, "God, I feel great." He was up walking around. They say, "Stop doing that. You've got a new heart." 5 days later, he was discharged. And coincidentally, his back pain and neck pain were gone. So when people are open to believing that they can be healed by this heart, opening that up, what I do is I get very quiet and meditate and just invite the divine in and help you to remove your blocks to love's presence and accept that love. And it's a proportion thing. So if you have a lot of doubt and fear, this isn't going to work. Okay, it's not going to work. But if you say, "I'm willing to try and open up." I talked to a man the other day. He had a right-sided stroke, and he says, "I can only do this with my hands, move my finger." I said, "Be grateful." He called me today. He says, "I'm moving my arm and my leg." And they're like, "How is that possible?" And I told him that you have to get in touch with your divine nature. I told him how to do that. And I said, "I see you as healed. The body follows what your mind thinks. Your body's a projection of your mind. So if you believe that you're going to be paralyzed for life, that's your self-fulfilling prophecy. But if you change your mind and say, I'm going to talk to this guy and I'm going to help you change your mind. And you're going to give you, I don't give people hope. I give them intention and tell them how to do this. So you can heal anything with the power of the divine. And specifically, you do not ask to be healed from a stroke or financial problem. You ask for peace. Father, reveal yourself. Let me feel your love. And I'm going to let that love flow through me into my life. And in the Bible, it says, seek ye first the kingdom of God, and everything else shall be added unto you. Those are the added things. Oh, I see your arm, this stroke, as darkness. Let's bring light to that. God's light. God is the only power in this universe. And when you stop choosing this victim mentality, you heal. Because God's natural state is one of health. God did not create the stroke. We did. You see? And so you learn to be quiet and just invite the divine in. And then as you start to heal, I can move my arm. Then I say, express gratitude and thank God, because gratitude equals abundance. So now his arm's moving, his leg's moving. It's just,
That's
you
very
have to
powerful.
change.
And I think we're all waking up to that power. I believe that this is why in medicine it is more and more difficult for companies to overcome the placebo effect when they're testing different modalities of healing, because our minds are becoming more powerful. We hear stories like this about the ability to heal and the mindset of healing. And when somebody else hears that, if they truly believe it, they wind up being able to emulate it. And then that just as a ripple effect to everybody who watches and listens.
Yes. It's like you throw a stone into a pond and you get this ripple effect, wave after wave after wave. How come it's not just one wave? It's many. And it goes into your past, it goes into your future, it touches lives. So it's a blessing of love that you're doing by bringing the divine in. And once you open your mind, the divine comes in, it touches everything and everybody. And the world that you're
Beautifully
looking at
said.
is blessed. The entire world is blessed. It goes back
Will you also
generations, it
share
goes
with us,
forward.
you have a special practice where you bless the world. Will you share with everybody what you do and how you do that?
Oh, sure. It's a meditation. I get quiet and comfortable, and then I ask the divine. Well, first I literally push my ego off to here, because I hear with my right ear. I just get over there. You just be quiet now, and I want to hear what God has to say. And in this meditation, I get really quiet, and I'll say, "Show me the earth." So the earth, when I see it, like right now, is very dark, and the background's a light gray. I don't see stars and all the cities that you see. It's always monochromatic in the astral dimension for me. And so then I start to see this beautiful white light come down into me, and it bends at my heart, and it's like a sphere of light that comes out. And I look at the earth, and I let the light go to the earth. And the earth is a ball about that big. And then I start to see the black drip off the earth. And I see the earth being washed in this beautiful white love. It's amazing. Then as I do this, I start to go towards the earth, and I start to see people, the white outline of people. I can see their faces. And I bless them with more love, and they start to change. And I know that despite the appearances of what's going on in the world, the earth is evolving. It's like cracking the egg. It's like California. They show you these horrendous forest fires, and everybody's going, "Oh my God, all these houses, these people." They never show you the aftermath. But there are certain seeds that germinate only under intense heat. So aftermath, they don't show you all the flowers and the new plants and the new life that germinated. That's what we're going through, is God's holy fire. We're burning off what the Bible calls the dross so that the purity can come out. That's all we're doing. So
Right.
I can see that and bless that. And I do that, several times a week. Blessing, I call it blessing the sonship. There are inside the earth, I call them stick people, but there's life inside our planet. It's in spiritual life. And then I see the astral plane, and then I see the divine. So there's these levels that we go through. And and I just say, I bless all of it. God's love is so expansive. It just, you end up going through the Milky Way. Then you go beyond the Milky Way and see millions of galaxies, and you have the power to bless all of that, because that's what God does. And it's just an incredible trip.
Well,
So
thank you so
that's the
much for
story.
sharing that. I think that's the beauty of doing and having these collaborative conversations, because you have the ability to share some of this knowledge so that people can take these techniques that you've honed over time and learn how to implement them into their own lives. So thank you very much for sharing that. And Dr. Rod, I'm sure that people watching are going to want to connect with you. I know that you've written a book. So will you tell people how they can work with you and where they can get your book?
Well, the book's on Amazon, so that's pretty easy. When God Calls, Say Yes. And it's just about my growth as a mystic. I have rewritten the book because I want to write a second book called The Unreality of Death, because I've had so many experiences with that. I have numerous experiences. Death is not real. It's a transition from one form of energy to another. And you never die alone. As I said before, you've got people on this side and you got people on the other side. And if you learn to relax into death and be at peace, let go of your grievances, your upsets, and forgive, you die, and it's very peaceful. It's my goal as a physician, is to make that transition for them as peaceful as possible. So I write about that in the book. So it's on Amazon. It's a short read because I have read books that are like 500 pages. I said, get to the point. I'm an ER doctor. Just the facts, man. So, but I put in the stories, true stories of my experiences. And then what I do afterwards is how I help people to heal. So I talk about different case scenarios, things like that. And I don't want to spoil it for people, but there's more stories. I also started a medical spiritual consulting practice. So it's drrodchelberg.com, my name, and you can schedule a time and we talk. And I can look at you and say, oh, here's your problem. And I can explain it. And then I find the cause of your problem. And it's usually a childhood trauma or a past life trauma. And I'll say, here's what's coming through that you need to work on. And the mistake people make is they go outside of themselves to doctors. No offense, guys, but true healing is a bridge. So you use my help, but you also go into your heart and open your heart to the divine and say, help me to be at peace. Not heal me of this cancer, but help me to be at peace. So that's turning within. And then the added things come to you. So I ran a chemo clinic for a couple of years, and all these women had breast cancer. And I said, let's stop being so sour and unhappy. Let's have fun and realize this has no power over me. Just as Christ said to Pontius Pilate, you have no power over me. You're an illusion. And treat it that way. And that's darkness. And God's light comes in and starts to wash it away. You bless it, you're grateful. And how about that? You healed. So one lady, she had stage 4 breast cancer, worked with her for about 6 months, completely gone. But she had to be willing to accept that she's worthy of God. She says, I'm not worthy of God. That's what we're taught. That's your belief. And if you look at the word belief, you see the word lie in it. It's all lies. So what does God have to say? So you learn to be quiet and meditate and invite the divine in and to be held by that. That's where I help people. And then I give you homework, or I do the recording and I send it to you. And people listen to it. Then they call back and they say, I have had chronic bladder cystitis since whenever. It's gone. I've had this pain. It's gone. It's not me. I can't cure you. I talk to you. I can listen to you, but it really doesn't matter. All we need to do is for you to sit, open your mind, get in touch with the divine. I help with that. And think of the illness as an illusion and it's darkness. So it's like going into your bedroom at night. What's the first thing you do? You turn on the light, right? That's how simple it is. We make it complicated. I would get a trauma patient in who was pretty banged up, and I would hold their hand and I say, oh, this doesn't look so bad. I thought you were in worse shape than this. He's in critical shape. But then I smile, I cut a joke and give him a little medicine. He totally relaxes and he allows that love to flow into him. And then he lives. It's how much are you willing to accept that you can heal yourself with the grace of God? How much are you willing to accept that you can walk in God's favor? You can reach your hand up and literally feel that and be guided. So some people are like, no, I'm an atheist. I'm a diehard atheist. Uh-oh. So one story, I'm just going to keep going. My dad passed away and he was an atheist. And when he died, I watched him. He came back and he stood there next to me with the biggest smile on his face and said, I was wrong. I am now in divine peace and I'm filled with joy. I saw Dad's families. There were 7 members. I saw all of them with him. They came to pick him up and help him come back. And then I was reading from A Course in Miracles, lessons 109, I rest in God. And that's when Dad appeared as his aura. And he just said, I was wrong. And he went home with a big smile. And I knew he was at peace. I was filled with love and joy. I didn't cry because that's where I want to go. It's just so blissful and so peaceful. There's nothing to fear. So you want to get to a point where you're relaxing and you're at peace. What I would do is ask the divine to come in and help all of us to adjust to this. And so that's what I did. I'm not afraid of death. I'm not afraid of illness. It has no power over me unless I give it power. So I lean on my father to help me. He helped me with 3 cancers. He helped me with a stroke and lots of other problems in my life. So it's you learn to trust and be at peace. And so my mantra is I choose peace instead of this, or I and my Father are one. I am a divine being and you are a divine being. Tap into that and you're going to have a beautiful life. It's practice. You're going to get a lot of resistance from your friends, so you don't want to talk to your friends about it. It's a private thing. But you're in constant communication with God. And it's just such a nice way to live. And you're going to fall down. You're going to have good days and bad days. So what? And I always say, I made a mistake. I reach up and I'm pulled up. So ultimately, in all situations, you want peace. You want the peace of God, the peace that passes all understanding. That is healing. That's the true healing. So the other one is icing on the cake. But to know God, to feel God, and be touched by God, and realize that I am that I am. It's that simple. It's that beautiful. So that's what I have to say.
Next up, check out this playlist of other NDE interviews. Please like and subscribe. It really helps this channel to grow so I can bring you more content. Thank you for watching. I'm so glad you're here.